So today we are discussing about orbital cavity and its contents. And the orbital cavity consists of, they are nothing but the bony cavities. They consist of eyeballs, muscles related to the eyeballs, blood vessels and nerves related to the eyeballs. Okay, so the orbital cavity is nothing but a bony cavity which protects the eyeball for the safe movement of the eyeball. Okay, coming to the contents of the orbit. We have eyeball is present, and also extraocular as well as intraocular muscles of the eyeball. Extraocular and intraocular muscles of the eyeball. Ocular muscles of the eyeball. Okay, and also we have orbital fascia. And facial sheath of the eyeball. Facial sheath of the eyeball, or otherwise called as bulbar fascia. Facial sheath of eyeball. And also cranial nerves. Second, third, fourth, sixth and some part of fifth cranial nerve, trigeminal nerve. That means ophthalmic division, ophthalmic and macular division of trigeminal nerve we can see in the orbit. Okay, some part of fifth cranial nerve. And also we have orbital fat is present. And also we have lacrimal gland is present in the orbit. And also we have lacrimal gland, orbital fat as well as lacrimal gland. Lacrimal gland is also content of the orbit. Okay, so these are the contents of the orbit. So the orbits are nothing but the bony cavities which lodges the eyeball. It protects the eyeball. Okay, and they are situated on either side of the root of the nose. The orbits are situated on either side of the root of the nose. They are situated on either side of the root of the nose. Here we can see the orbits here. They are situated on either side of the root of the nose. Okay, and the long axis of the orbit is nothing but it goes backwards and medially. The long axis of the orbit, it goes backwards and medially. The medial walls of the orbit, they are parallel to each other, whereas the lateral walls they set at right angles to each other. Okay, the medial walls of the orbit, they are parallel to each other. These are the medial walls, right on. These are the medial walls of the orbit, and the lateral walls are here. These are the lateral walls and the medial walls are here. Okay, the medial walls are parallel to the orbit, whereas the lateral walls, they set at right angles to the orbit. Okay, their walls are right angles. They are set at right angles. Okay, and so in the orbit we have eyeball is present which lodges the eyeball. And now we are discussing about all these contents. Of course, eyeball is a separate one, and extraocular as well as intraocular muscles of the eyeball, orbital fascia and facial sheath of the eyeball, cranial nerves, that means second, third, fourth, sixth and some part of fifth trigeminal nerve also, and orbital fat is present, as well as lacrimal gland is also present in the orbit. Okay, and also along with the cranial nerve we have ophthalmic artery is also present in the orbit. Ophthalmic artery. Okay, ophthalmic artery and also superior and inferior ophthalmic veins, ophthalmic vessels, ophthalmic artery and superior, inferior ophthalmic veins. Ophthalmic veins are also present, and some lymphatics are also present in the orbit. Lymphatics are also present in the orbit. Okay, so coming to the fascia covering the orbit. First, coming to the fascia covering the orbit. The fascia covering the orbit is the orbital fascia. It is nothing but orbital fascia is nothing but the periosteum of the bone. The fascia covering the orbit is so this is the eyeball and this is the optic nerve. Okay, so we will discuss now about the orbital fascia. Okay, the orbital fascia is nothing but the periosteum of the orbit. The orbital fascia is nothing but the periosteum of the orbit, and it can be easily stripped off. And also the orbital fascia, it is deficient over the inferior orbital fascia. So this is the inferior orbital fissure, and the orbital fascia is absent here. See, the orbital fascia is absent in the nearer to the inferior orbital fissure. In that area there is not absent, there exists a gap between the inferior orbital fissure and orbital fascia. There exists a gap between the inferior orbital fissure and orbital fascia, and this gap is filled by a muscle, smooth muscle called orbitalis muscle. Orbitalis muscle. It is filled by a smooth muscle called orbitalis muscle, and the action of this muscle is uncertain. The action of this muscle is uncertain. So it does nothing but the orbital fascia. The orbital fascia, it is nothing but the periosteum of the orbit. It is nothing but the periosteum of the orbit, and it can be easily stripped off. And there exists a gap between the inferior orbital fissure and the orbital fascia. And here the gap, it is filled up by a smooth muscle called orbitalis muscle, and the orbital fascia, it extends backwards. The orbital fascia, it extends backwards and is continuous with the dura mater as well as the facial sheath of the optic nerve. The sheath of the optic nerve, it is continuous with the dura mater and the sheath of the optic nerve, and anteriorly it continuous and it is continuous with the so the orbital sheath posteriorly, it is continuous with the dura mater as well as the fascia covering the optic nerve, and anteriorly it continuous with the ostium. It is continuous with the periosteum. It is continuous with the periosteum surrounding the bones of the orbit. It is continuous with the periosteum surrounding the bones of the orbit. Okay, so the orbital fascia, it is nothing but the periosteum, and it can be easily stripped off. The orbital fascia, there exists a gap between the orbital fascia and the inferior orbital fissure, and this gap is filled by the smooth muscle called orbitalis muscle. And here the orbital fascia posteriorly is continuous with the dura mater as well and facial sheath of the optic nerve, and anteriorly the orbital fascia, it is continuous with the bones covering the orbital fascia. It is continuous with the bones covering the margins of the orbit. Okay, and coming to the extensions of the orbital fascia. The orbital fascia sends various septa to the upper and lower eyelid. We call it as orbital septum. The orbital fascia sends extensions to the eyelids, upper and lower eyelids. They form the orbital septum, and also the orbital fascia, it extends as a pulley surrounding the superior oblique muscle. You know that superior oblique muscle, it is by a fibrous pulley, and the orbital fascia, it is bridges the tendon of the superior oblique muscle as the superior oblique muscle. It is a voluntary muscle of the eyeball, and the orbital fascia, it sends a extension. It bridges the pulley of the superior orbital muscle and also superior oblique muscle, and also the orbital fascia, it bridges the lacrimal bone as the lacrimal fascia, as lacrimal gland as lacrimal fascia. One is orbital septum. The orbital fascia sends extensions into the upper and lower eyelids forming the orbital septum, and also the orbital fascia bridges the tendon of the superior oblique muscle, and also the orbital fascia, it bridges the lacrimal gland as the lacrimal fascia. This is the lacrimal fascia. This part we call it as lacrimal fascia. This is the lacrimal gland. Okay, this is the lacrimal gland, and it forms an extension over the lacrimal gland. That is as lacrimal fascia. So that's about the orbital fascia. So the orbital fascia, it surrounds the orbit, and it is nothing but the periosteum of the orbit, and it can be easily stripped off. And the orbital fascia is it doesn't cover the inferior orbital fissure, and the gap between the orbital fascia and the inferior orbital fissure, it is by the smooth muscle called orbitalis muscle. The orbital fascia posteriorly, it extends to the dura mater, as well as the facial sheath of the optic nerve, and also anteriorly it extends anteriorly it continues with the periosteum of the surrounding bones of the orbit. Okay, and also the orbital fascia sends various expansions into the upper and lower eyelids. They are called orbital septum. The orbital fascia, it bridges the tendon of the superior oblique muscle. We know the superior oblique muscle, it consists of a fibrous pulley is present in the superior oblique muscle, like fibrous pulley is present here in the superior oblique muscle, and the orbital fascia bridges over the tendon of the fibrous pulley over the tendon of the superior oblique muscle, and the orbital fascia, It extends into the lacrimal bone, lacrimal gland. It extends over the lacrimal gland as the lacrimal fascia. Okay, these are the extensions of the orbital fascia. Okay, coming to the next one, that is nothing but the facial sheath. Next one is the facial sheath of the eyeball. Next one is the facial sheath of the eyeball. So, the orbital fascia is over, and coming to the facial sheath of the eyeball, the facial sheath of the eyeball is nothing, is a loose covering over the eyeball. We call it the Tennant's capsule. The facial sheath of the eyeball, otherwise called as Tennant's capsule. Okay, it bridges over the eyeball, it surrounds the eyeball and as well as the optic nerve. So this one as surrounds the eyeball, we call it as facial sheath of the eyeball. This is the facial sheath of the eyeball. We can see here, this is the facial sheath of, this is the orbital fascia and this is the facial sheath of the eyeball. Okay, so the facial sheath of the eyeball or Tennant's capsule. Okay, our Tennant's capsule is covers the eyeball as well as the optic nerve up to the, it covers the eyeball up to the corneoscleral junction. It covers the eyeball up to the corneoscleral junction. There exists a space between the sclera and the fascia. We call it as episcleral space, and the various delicate fibrous bands are exist in the space. And also this fascia, it allows the free movements of the eyeball. So the Tennant's capsule surrounds the eyeball as well as the optic nerve. It surrounds the eyeball up to the corneoscleral junction. There exists a space between the fascia as well as the sclera. We call it as episcleral space. And in this episcleral space consists of delicate fibrous bands. And this episcleral space, it allows the easy movement. This allows the easy movements of the eyeball. Okay, and here coming to the structures piercing the Tennant's capsule as facial sheath of the eyeball. What are the structures piercing? They are nothing but the tendons of the extraocular muscles of the eyeball, tendons of the extraocular muscles of the eyeball, as well as the ciliary nerves and muscles. They enter the ciliary nerves and vessels. They enter the eyeball through the optic nerve. They also pierce the nothing but facial sheath of the eyeball. So the facial sheath of the eyeball or Tennant's capsule or bulbar fascia. They are also called as bulbar fascia. It surrounds the eyeball up to the corneoscleral junction as well as it surrounds the optic nerve also. There exists a space between the facial sheath and the sclera. We call it as episcleral space, and in this space we consist of various delicate fibrous bands are present here, and also here the sheath, nothing but the bulbar fascia or facial sheath of the eyeball, it is pierced by the tendons of the extraocular muscles of the eyeball as well as the ciliary nerves and vessels which enters the eyeball through the optic nerve. Through the optic nerve, ciliary nerves and vessels enter the eyeball through the optic nerve. So that's about the facial sheath of the eyeball. And coming to the expansions of the facial sheath of the eyeball, now there are the three expansions. First of all, it forms a tubular sheath around each tendon of the eyeball. See here, this is the green one around the eyeball is nothing but the facial sheath of the eyeball. It forms a tubular sheath around the tendons of the extraocular muscles of the eyeball. We can see here, it forms a tubular sheath around the tendons of the each extraocular muscles of the eyeball, and this is the facial sheath of the eyeball or Tennant's capsule. It forms a extension over the eyeball. The black ones I have represented, but these are nothing but the extraocular muscles of the eyeball. This is superior oblique, and this is superior rectus, and this is lateral rectus, and this is medial rectus, this is inferior rectus, and this is inferior oblique. So the facial sheath of the eyeball, it forms a tubular sheath around each tendon of the eyeball, around each tendon of the extraocular muscle of the eyeball. And here the facial sheath of the eyeball, it forms a triangular flap-like extension. The triangular flap-like extension. Okay, triangular flap-like extension from the this is the medial rectus, facial sheath covering the medial rectus muscle, and this is the facial sheath covering the lateral rectus muscle. We know that the facial sheath of the eyeball, it surrounds the each tendon or each muscle of the eyeball with forming a tubular sheath, right? So the facial sheath of the eyeball or Tennant's capsule, it extends a triangular flap-like extension from the facial sheath of the medial rectus. This is the medial rectus and this is the lateral rectus. And from the facial sheath of the medial rectus, it sends a triangular flap-like extension which is attached to the lacrimal bone. This is called, this one we call it as medial triangular ligament. This one we call it as medial triangular ligament. Medial triangular ligament. Okay, and what is medial triangular ligament? It is nothing but the extension of the facial sheath of the eyeball. And coming to the this one, this is the lateral triangular ligament. Lateral triangular ligament. Okay, and what is lateral triangular ligament? It is nothing but a triangular flap-like extension of the facial sheath of the eyeball from the sheath of the lateral rectus muscle to the, here we have from the sheath of the lateral rectus muscle to the zygomatic bone here, to the zygomatic bone here. Okay, so that's about the lateral triangular ligament and medial triangular ligament. There are three extensions. There are three extensions from the facial sheath of the eyeball. One is orbital septum, orbital sheath. Sorry, one is orbital sheath, or not orbital sheath. It is tubular sheath, and this tubular sheath is nothing but the facial sheath of the eyeball, which surrounds the each muscle of the eyeball, forming the tubular sheath. Okay, and coming to the medial triangular ligament and lateral triangular ligament. The medial triangular ligament is a triangular flap-like extension from the sheath of the medial rectus muscle to the lacrimal bone. This is the lacrimal bone here. Okay, and coming to the lateral rectus muscle, it is nothing but a a sheath from the lateral rectus muscle to the zygomatic bone. This is the lateral triangular ligament. Okay, and one more ligament is there, that is nothing but the suspensory ligament of the eyeball. That is nothing but the suspensory ligament of eyeball. Suspensory ligament of eyeball. So what is suspensory ligament of eyeball means? The suspensory ligament of eyeball, it is situated below the eyeball, and it hangs like a hammock. Hangs like a hammock. It is broadened in the middle and narrowed at its end. It is broadened in the middle, and it extends from the facial sheath of the inferior rectus and inferior oblique up to the medial part and up to the lateral triangular ligament as well as the medial triangular ligament. This is the lateral triangular ligament. And this is the medial triangular ligament. The suspensory ligament of the eyeball extends from the margins of the sheath of inferior rectus and inferior oblique to the lateral triangular ligament and to the medial triangular. It continues with the lateral triangular ligament as well as the medial triangular ligament. It is present below the eyeball. It hangs out from the inferior part of the eyeball. It is broader at its center and narrower at its end. It is broader at its center and narrower at its end. It is formed by the tubular sheath. It is formed by the sheaths around the margins of the inferior rectus and inferior oblique and extends to the lateral triangular ligament as well as the medial triangular ligament. So that's about the lateral triangular ligament as well as the medial triangular ligament. Okay, and also suspensory ligament of the eyeball. So what is facial sheath of the eyeball means? The facial sheath of the eyeball, it closely surrounds the eyeball and also it closely surrounds the optic nerve, and it closely surrounds the eyeball up to the corneoscleral junction. There is a space between the sheath and the sclera. We call it as episcleral space, and it consists of delicate fibrous bands, and also it is this facial sheath of the eyeball. It is pierced by tendons of the extraocular muscles of the eyeball as well as the ciliary nerves and vessels which enters the eyeball through optic nerve. This is the facial sheath of the eyeball. And coming to the extensions of the facial sheath of the eyeball, this facial sheath of the eyeball, it forms a tubular sheath. It forms a tubular sheath around each tendon of the extraocular muscles of the eyeball, and also this it forms a triangular expansion from the sheath of the medial rectus muscle to the lacrimal bone. We call it as medial lacrimal ligament, and also from the lateral rectus muscle to the zygomatic bone. We call it as lateral triangular ligament. And there exists another ligament called suspensory ligament of the eyeball, and this suspensory ligament of the eyeball is broader at its center and narrowed at its end. The suspensory ligament of the eyeball is nothing but the fascia surrounding the margins of the inferior rectus and inferior oblique and extends up to the lateral triangular ligament as well as the medial triangular ligament. So that's about the orbital fascia as well as the facial sheath of the eyeball, otherwise called as Tennant's capsule or bulbar fascia. And coming to the extraocular muscles of the eyeball, we have extraocular muscles which are voluntary muscles as well as intraocular muscles which are involuntary muscles. We will discuss them in detail now. So today we will discuss about the voluntary muscles of the eyeball. And coming to the voluntary muscles of the eyeball, they are superior rectus muscle, inferior rectus muscle, middle rectus muscle, lateral rectus muscle, and also we have superior oblique, inferior oblique, and also we have levator palpebrae superioris. These are the extraocular muscles of the eyeball which are voluntary in action. Extraocular muscles of the eyeball which are voluntary in action. And we have superior rectus, inferior rectus, medial rectus, and lateral rectus. Superior rectus means rectus. Superior rectus, middle rectus, inferior rectus, and lateral rectus. All the recti muscles, they arise from the common tendinous ring. All the recti muscles, they arise from the common tendinous ring present in the superior orbital. In the middle part, this common tendinous ring, it occupies the middle part of the superior orbital fissure. So this is the superior orbital fissure, and this is the common tendinous ring. All the recti muscles, they arise from the superior common tendinous ring. All the recti muscles, they arise from the common tendinous ring, and this common tendinous ring, it is situated in the middle part of the superior orbital fissure. Okay, and see here, superior rectus here arises from the this is the common tendinous ring, superior rectus, middle rectus, inferior rectus, and lateral rectus. And the lateral rectus head, some part of small head also arises from the greater wing of the sphenoid. So the lateral head arises, the lateral recti muscle arises from the common tendinous ring, or also a small part of its head arises from the greater wing of sphenoid. So this is the greater wing of sphenoid, this is the lesser wing of sphenoid, and this is the body of the sphenoid. Lesser wing, greater wing, and body of the sphenoid. Okay. So the lateral rectus muscle, a small part, apart from the common tendinous ring, a small part also arises from the greater wing of sphenoid. Okay, and coming to the superior oblique muscle. Superior oblique muscle arises from the under surface of the lesser wing of sphenoid. From the under surface of the lesser wing of sphenoid, this is the lesser wing of sphenoid, and the superior oblique arises from the under surface of the lesser wing of sphenoid, superior oblique muscle. And coming to the inferior oblique muscle arises from the orbital surface of the maxilla. So this is the maxilla, and this is the orbital surface of the maxilla. This is the orbital surface of the maxilla, and this is the maxilla. So the inferior oblique arises from the orbital surface of the maxilla. And also coming to the levator palpebrae superioris. Levator palpebrae superioris arises from the orbital surface of the lesser wing of sphenoid. The orbital surface of the lesser wing of sphenoid, anterosuperior to the optic canal. Anterosuperior to the optic canal. In the optic canal, we have ophthalmic artery and as well as the optic nerve was present in the optic canal. The artery lies inframedial to the nerve. This is the nerve. The blue one I have represented with is the nerve, and the red one is the artery. In the optic canal, we have optic nerve as well as ophthalmic artery is present. Optic nerve as well as ophthalmic artery is present. And here we can see levator palpebrae superioris is present. Or levator palpebrae superioris, it lies anterosuperior to the optic canal, and the superior oblique lies superomedial to the optic canal. Superomedial to the optic canal, and the levator palpebrae superioris lies anterosuperior to the optic canal, and the superior oblique lies superomedial to the optic canal. This is the medial side of the orbit, and this is the lateral side. Okay, that's why medial rectus it is present here. Medial rectus it is present here. Okay, and so that is the origins of the extraocular muscles of the eyeball. See here, all the muscles of the eyeball, all the recti muscles of the eyeball, I mean superior rectus, inferior rectus, middle rectus, and lateral rectus, they arise from the common tendinous ring, and this common tendinous ring occupies the middle part of the superior orbital fissure, and the lateral rectus muscle, apart from the common tendinous, it takes origin from the greater wing of sphenoid also. And here we can see the superior oblique muscle. Superior oblique muscle arises from the under surface of the lesser wing of sphenoid, and the levator palpebrae superioris arises from the orbital surface of the lesser wing of sphenoid, as well as the inferior oblique I have shown you, it arises from the orbital surface of the maxilla. Okay, and coming to the here we have represented these are nothing but the oculomotor nerve and two divisions of the oculomotor nerve, and between the two divisions of the oculomotor nerve we have nasociliary nerve is present, and this is the abducens. So what are the nerves that are passing through the common tendinous ring? Two divisions of the oculomotor nerve, third cranial nerve is the oculomotor nerve, and the two divisions they are separated by the nasociliary nerve, and here we have abducens nerve, which is nothing but the sixth cranial nerve. Outside the common next we have lacrimal nerve, frontal nerve, and trochlear nerve is present. This is the meningeal branch of ophthalmic artery, and the black ones I have represented with, they are nothing but the superior and inferior ophthalmic veins. Okay, so that is the origin of the all the voluntary muscles. And coming to the insertion there, all the recti muscles they get inserted into the sclera, separated by sclerocorneal junction. All the recti muscles they are inserted into the sclera of the eyeball. All recti muscles are inserted to the sclera of the eyeball, and here this is the superior oblique muscle, and this is the inferior oblique muscle. The superior oblique muscle, it is held by a fibrous pulley. We know that the orbital fascia sends an expansion to hold an expansion to hold the fibrous pulley of the superior oblique muscle. This is the superior oblique muscle, and this is the inferior oblique muscle. The superior oblique muscle runs downwards and laterally, and here it gets laterally and gets inserted into the sclera between the superior rectus and lateral rectus. This is the superior rectus and this is the lateral rectus, between the superior rectus and lateral rectus. And the inferior oblique muscle also, it runs downwards, backwards as well as laterally below the inferior rectus muscle. This is the medial rectus, and gets inserted into the sclera a little posterior as well as below the superior oblique. Okay, all the muscles they are inserted into the sclera. Okay. And that's about it. And coming to the levator palpebrae superior, it is divided into superior lamella as well as inferior lamella. Levator palpebrae superior is divided into superior lamella inserted into the anterior surface of the tarsus, and also skin of the upper eyelid, and also the inferior lamella, it is also inserted to the upper margin of the superior tarsus as well as to the superior conjunctival fornix. Okay, that's about the levator palpebrae superior. It inserted into the tarsus here. Okay, levator palpebrae superior, that is from the orbital surface of the lesser wing of sphenoid. Okay, that's about the origins of all the recti muscles. And coming to the actions of the recti muscles, they cause elevation of the eyeball. Along the transverse axis they got elevation, and also they got depression, elevation, and also medial rotation. Along the vertical axis they call medial rotation, and as well as lateral medial rotation, that means adduction and abduction. Adduction means towards the medial and abduction, as well along the anteroposterior axis they cause intorsion and extorsion. Okay, like this and like that. Intorsion, extorsion. We will discuss here in the diagram. For example, if you take this is the 12 o'clock position of the eyeball, and we take the 12 o'clock position of the eyeball. So see here, or this one, the arrow I have represented with it is nothing but the elevation. The arrow I have represented with is nothing but the adduction or medial rotation, and this is the elevation. The arrow I have represented to the lateral aspect is nothing but the abduction or lateral rotation. The arrow I have represented with this one is nothing but the intorsion, and the arrow represented above is the extorsion. Intorsion and extorsion. Okay, so intorsion and extorsion, like this. Okay, so what are the muscles that causes the elevation? So elevation means I have represented the arrow above, superior rectus as well as the inferior oblique. It causes elevation of the eyeball. And what are the muscles that causes depression of the eyeball? We can see here inferior rectus and superior oblique. Inferior rectus and superior oblique, they cause depression of the eyeball, elevation and depression. Shiva, okay, so all the recti muscles they get inserted to the sclera. And here we can see the superior oblique muscle. Superior oblique muscle, it is holded by, it is consists of a pulley, fibrous pulley here, and which is know that we know that the orbital fascia which sends an expansion to hold the pulley of the superior oblique muscle, which passes below the superior rectus muscle and gets inserted into the sclera between the superior rectus as well as the lateral rectus muscle. And coming to the inferior oblique muscle, it also passes below the inferior rectus muscle, passes downwards, backwards and laterally, and gets inserted to upwards, backwards and lateral, and gets inserted to the sclera a little below and posterior to the superior oblique muscle. And levator palpebrae superioris, they get inserted to the eyelid, upper eyelid, superior tarsus by dividing into superior lamella and inferior lamella. It gets inserted into the superior tarsus. Okay, that's and coming to the actions of the eyeball, we know that the superior rectus causes elevation and inferior oblique. The elevation is caused by superior rectus as well as the inferior oblique. Okay, and coming to the depression is caused by here. Depression means downward arrow. Inferior rectus and as well as the superior oblique. Inferior rectus and superior oblique. Okay, and coming to the lateral rotation by the lateral rectus muscle, and medial rotation by the medial rectus muscle. And coming to the intorsion by the superior rectus as well as the superior oblique. Intorsion means I have represented like this with this arrow. Intorsion. Okay, and also this one, superior oblique, causes intorsion of the eyeball. And coming to the extorsion, it is caused by the inferior oblique as well as the inferior rectus. Inferior oblique, inferior rectus, they cause the extorsion. Superior rectus as well as the superior oblique, they cause the intorsion. Okay, so these are the, and the medial rotation, it is caused by the inferior rectus as well as superior rectus as well as the medial rectus. And the lateral rotation, that means abduction, it is caused by the lateral rectus, inferior oblique and superior oblique. So this is lateral one, and this is the medial rotation arrow, and this is the lateral rotation arrow. This is elevation of the eyeball, this is depression of the eyeball, this is intorsion, and this is extorsion. Okay, so these are the various actions of the muscle movements. And coming to the intraocular muscles, they are superior tarsus and inferior tarsus muscles are the intraocular muscles of the eyeball. They get inserted to the tarsal plate here. Superior tarsus gets inserted to the tarsal plate here, and the inferior tarsus also inserted to the tarsal plate here, and they attach it to the tarsal plate here. And levator palpebrae, we know that the orbital muscle is a smooth muscle. The function of the orbital muscles is yet to known. Extraocular muscles of the eyeball, that means ectile muscles and the oblique muscles as well as the levator palpebrae superioris, they are very, very important. Extraocular muscles of the eyeball is very, very important question. And coming to the arteries of the eye. Coming to the artery of the eyeball, ophthalmic artery is a branch from the internal carotid artery, supplies the eyeball. And the ophthalmic artery, first it lies lateral to the artery, and it lies in the dural sheath along with the optic nerve. And within the dural sheath, it gives an important branch. Ophthalmic artery, it gives an important branch that is nothing but the central artery of the retina. This is the central artery of the retina. This is the central artery of the retina here. This is the central artery of the retina. And coming to the next one, that is without the artery, we know that the artery crosses the optic nerve from lateral to medial side. This is the lateral aspect and this is the medial aspect. The ophthalmic artery, this is the ophthalmic artery. The ophthalmic artery, it reaches the medial aspect by crossing over the optic nerve. And here we can see this is the central artery of the retina. This is the central artery of the retina, and the central artery of the retina, it is present within the, it arises from the ophthalmic artery within the dural sheath, and outside the dural sheath one important branch arises from the ophthalmic artery, that is the lacrimal artery. This is the lacrimal artery. So the artery now crosses from lateral to medial side. The artery now crosses from lateral to medial side, and here it gives it divides by terminating into two branches. Terminates by dividing into two branches. One is supraorbital and supratrochlear. Supraorbital and supratrochlear, they supply the skin of the forehead, and also it gives one important branch that is called dorsal nasal branch, which supplies the part of the nose, and also it gives two branches, that is anterior and posterior ethmoidal arteries, they supply the ethmoidal air sinuses here, then, and also the lacrimal branch which arises from the lacrima, which arises from the ophthalmic artery outside the dural sheath. Outside the dural sheath, after piercing the dural sheath, it gives zygomatic temporal and zygomatic facial branch, and also it supplies the lacrimal gland here. It also supplies the lacrimal gland here, and also the artery, the ophthalmic artery, gives one important branch, that is posterior ciliary artery. Posterior ciliary artery supplies the iris and choroid. It supplies the iris and choroid here, and the central artery of the retina is the end artery, and it doesn't anastomose with any artery. So occlusion of the arteries causes complete blindness. Okay. And also muscular branches also supply, the muscular branches also arises from the ophthalmic artery, and one of the muscular branch forms the anterior ciliary artery here. This is the anterior ciliary artery, which also supplies the iris and the choroid. Okay, that's about the branches of the ophthalmic artery. So what are the branches of the ophthalmic artery? So ophthalmic artery gives two important branches. One is central artery of retina and lacrimal branch. This central artery of the retina, it arises from the ophthalmic artery within the dural sheath of the optic nerve. This central artery of the retina supplies the iris, supplies the retina, and it is an end artery. It doesn't anastomose with any other arteries. So a occlusion of the central artery of the retina results in complete blindness. And coming to the lacrimal branch runs along the lateral aspect of the orbit, and here the lacrimal gland gives three important branches. One is zygomatic temporal and zygomatic facial, and another branch is which supplies the lacrimal gland. And here these are the two large branches of the ophthalmic artery. Ophthalmic artery arises from the internal carotid artery. Ophthalmic artery arises from the internal carotid artery. It lies in the optic canal, introlateral to the optic nerve. Then it crosses the artery superficial to the artery from lateral to medial side. And what are the remaining branches of the ophthalmic artery are? What are the remaining branches of the ophthalmic artery? It ends by terminating into two branches, supraorbital and supratrochlear, which supplies the skin of the forehead. It also gives branches anterior ethmoidal and posterior ethmoidal, and also it gives dorsal nasal branch, dorsal nasal artery. And within the superior orbital fissure, it gives one important branch, that is the recurrent meningeal branch, which supplies the meninges. This is the recurrent meningeal branch. We can see that this is the recurrent meningeal branch of the ophthalmic artery, and also it gives posterior ciliary branches. It also gives posterior ciliary branches, which supplies the iris and choroid. And here anterior ciliary branches are also arises from one of the muscular branches of the ophthalmic artery. Okay, so that's about the ophthalmic artery. So I'm coming to the vein, superior ophthalmic and inferior ophthalmic vein. Superior ophthalmic vein, it accompanies the ophthalmic artery and it drains into cavernous sinus. And coming to the inferior ophthalmic vein, it lies below the optic nerve, and it also drains into superior ophthalmic vein, and or it may drains into the cavernous sinus. Lymphatics, they drain into lymphatics of the eyeball, they drain into preauricular group of lymph nodes. Okay. And coming to the optic nerve, so we'll discuss them optic nerve in detail now. So the optic nerve consists of axon cells, arises from the ganglionic cells of retina, and the optic nerve arises from the ganglionic cells of the retina, and the optic nerve consists of myelinated nerve fibers, and the optic nerve consists of the myelinated nerve fibers. It arises from the ganglionic cell layer of the retina, and the optic nerve consists of axons of the ganglionic cell layer of the retina, and this optic nerve, it passes backwards and it enters the optic canal, and from the optic canal it enters the optic chiasma. So the optic nerve it is about 4 centimeters long. The optic nerve, it is about, we know that the optic nerve is situated. We know that the optic nerve, this is the optic nerve, right? This is the optic nerve. Okay, it runs backwards and it enters the optic canal, and from the optic canal it enters the middle cranial fossa to reach the optic chiasma. In the optic chiasma, 53% of the nerve fibers they decussate. They decussate. 53% of the nerve fibers they decussate. And here, what is optic nerve? Nothing but it consists of nerve fibers arranged. The cell bodies are situated in the ganglionic cell layer of the retina. And in the optic nerve, it is crossed superficially. The optic nerve, it is crossed superficially by the ophthalmic artery, superior ophthalmic line, and nasociliary nerve. And it is crossed, and also the optic nerve, it is inferiorly related to the nerve to medial rectus. And it is also inferiorly related to the nerve to medial rectus. And the optic nerve, it is nothing but a extension of the dura mater. It is nothing but an extension of the dura mater. And here the optic nerve consists of fibers arises from the ganglionic cell layer of the retina. So now we are discussing about lacrimal apparatus. Lacrimal apparatus is nothing but how the secretions of the fluid takes place, tear fluid takes place, and how the drainage of the tear fluid takes place. So secretion and drainage of the tear fluid constitutes the lacrimal apparatus, and the lacrimal apparatus consists of lacrimal gland, conjunctival sac, and lacrimal punctum and canaliculi. Lacrimal punctum and canaliculi, lacrimal sac, and also lacrimal sac, and finally we have nasolacrimal duct. Duct. Okay, so coming to the lacrimal gland is situated in the anterolateral roof of the orbit in a groove called lacrimal groove, and in the lacrimal gland consists of two parts, orbital part and palpebral part. Orbital part situated in the orbit and the palpebral part situated in the upper eyelid, and the orbital part is comparatively larger when compared to the palpebral part. Orbital part is comparatively larger when compared to the palpebral part. And here the ducts from the gland, lacrimal ducts from the orbital part, they have to pass through the palpebral part. So if we remove the palpebral part, it is nothing but removing the entire gland, because the ducts from the orbital part pass through the palpebral part, and they open into the conjunctival sac. And the lacrimal gland, it is supplied by the lacrimal branch of the ophthalmic artery and nerve by the lacrimal nerve. Okay. And here the fluid, the secretions from the lacrimal ducts, they open into the conjunctival sac. Here what happens here is the spread of the fluid takes place over the conjunctiva, and here periodic blinking of the eye helps in the spread of the fluid, and most of the fluid evaporate, and remaining part of the fluid, they are drained by the lacrimal punctum and through the lacrimal canaliculi. Remaining amount of the fluid, they are drained by the lacrimal canaliculi through the lacrimal punctum. And if excessive amount of the fluid takes place, it overflows over the cheeks. That condition we call it as euphoria. And here the lacrimal gland, it consists of two parts, orbital part and palpebral part. Orbital part situated in the orbit, and palpebral part situated in the upper eyelid. And the ducts of the gland, they pierce 10 to 12 ducts of the glands. They pass through the palpebral part also, from the lacrimal palpebral part, from the orbital part of the lacrimal gland, they pass through the palpebral part also, and they opens into the conjunctival sac. The conjunctiva surrounding the conjunctiva, which covers the deep part of the iris, we call it as palpebral conjunctiva. Then the conjunctiva over the eyeball, we call it as bulbar conjunctiva, and the space between the palpebral conjunctiva and bulbar conjunctiva, we call it as conjunctival sac, and the ducts open into the conjunctival sac. From here the spread of the fluid takes place, and most of the fluid evaporates, the lacrimal fluid evaporates, and a small part drained by, and a remaining part drained by the lacrimal. This is called lacrimal punctum. And the this part we call it as lacrimal canaliculi. From the lacrimal punctum, lacrimal canaliculi arises. Lacrimal canaliculi are about 10 mm long. Out of this, 2 mm is the vertical part. Out of this 2 mm is the vertical part and the remaining 8 mm is the horizontal part. 2 mm is the vertical part and the remaining 8 mm is the horizontal part. And the lacrimal punctum, the lacrimal canaliculi, they open into the lacrimal sac. This is the lacrimal sac. Lacrimal punctum or lacrimal canaliculi, they open. Lacrimal canaliculi, they open into the lacrimal sac, and the lacrimal sac is about 12 mm long and 5 mm width, 12 mm width and 5 mm long, 5 mm long and 12 mm wide. It has a blind superior end. Then from the lacrimal sac it continues as the nasolacrimal duct. From the lacrimal sac it continues as the nasolacrimal duct, and then here the nasolacrimal duct is about 18 mm long, and this nasolacrimal duct, it opens into the inferior meatus of the nose, and thus the opening of the duct, it is guarded by a valve called valve of Hasner. The opening, it is guarded by a valve called valve of Hasner. Okay, so 3 mm. So the lacrimal sac, it is a blind sac, which is the superior end is blind, and here inferior part of the sac, it is continuous with the nasolacrimal duct. It is about 12 mm long and 5 mm, 12 mm wide and 5 mm long. The canaliculi, they open into the lateral wall of the lacrimal sac. Okay, and here the lacrimal sac continues as the nasolacrimal duct, which is about 18 mm long, and this nasolacrimal duct opens into the inferior meatus of the nose. So here lacrimal gland, here the ducts opens into the conjunctival sac, and from the conjunctival sac the part of the fluid which is drained by the lacrimal punctum, and from the lacrimal punctum, lacrimal canaliculi, they open into the lacrimal sac. From the lacrimal sac to the nasolacrimal duct, it is open. The nasolacrimal duct opens into the inferior meatus of the nose. So that's about the lacrimal apparatus.